I'm Dr. Kavitha Bhat. I'm a pediatric endocrinologist at Aster CMI Hospital, Bengaluru. How can parents recognize the earliest signs of type 1 diabetes in very young children, especially when symptoms seem like regular infections or fatigue? So, there are certain symptoms of type 1 diabetes that enable early recognition. One of them is increased thirst and urination. Parents may note that the diapers are getting wet more often and they are more soggy than usual, and the child is constantly demanding feeds, which may be a manifestation of thirst in the very young. They're not able to verbalize their demands, so they may seem to want breastfeeds or formula feeds more frequently, which is an indication of increased thirst. And another symptom is that the child may not be gaining weight, or the weight gain would have become static. One of the fastest periods of growth is in infancy and toddlerhood, and the growth rate slows down. This also could be a clue. This growth rate slowing down in association with increased appetite. Generally, one would expect weight gain with increased appetite. However, in diabetes, despite increased appetite, there is weight loss or failure to gain weight. What are the biggest challenges in managing insulin therapy in toddlers and primary school children? Toddlers and the very young children, that is less than 6 years, offer a unique challenge to parents and physicians who take care of such children with diabetes. The one thing is they are very unpredictable in their eating behavior and in their physical activity. Parents have the burden of monitoring their blood sugar, deciding on the insulin dose, monitoring the food intake as well as activity levels in these highly unpredictable children. These children are not able to verbalize what they feel, and when they have a low blood sugar, which could be an effect of insulin or physical activity, they are unable to verbalize the symptoms of feeling low. And this is also a challenge in managing these children. The parents, it's always recommended that these, in any age group, the diabetes control be good to prevent long-term complications. And in this age, it's very hard to keep an HbA1c less than 7.5. Most parents administer insulin after the feed because they're not sure how much the child will consume, and this could lead to suboptimal blood sugar control. What is suggested is they split the insulin and give some before and some later based on how much the child has eaten. The tantrums and the normal toddler behavior, it may make it difficult to distinguish normal toddler behavior from symptoms of either hypo or hyperglycemia, which could also increase irritability, tantrums, and other such common symptoms. So it's an immense burden on parents. Devices like insulin pump would ensure flexibility for such children, and devices like continuous blood glucose monitoring devices would help monitor the blood sugar levels more closely and with lesser pricks. Could you give some tips on how to balance insulin injections with food? So the blood sugar or the glucose in blood is contributed from two sources. One is an internal source, which is the liver glycogen, which is a carbohydrate that the liver stores, and the second source, which is called an external source, which is from the food we eat. Food is made up of proteins, fats, and carbohydrates, and it's a carbohydrates that is broken down into glucose and absorbed into the bloodstream. So one needs to match the insulin that is given before food with the carbohydrates, and it's important that families learn about carbohydrate counting. By examining the pre-meal and 2-hour post-meal blood glucose levels, it is possible to define how much of insulin is needed by the child for an X amount of carbohydrates. We call this as an insulin carbohydrate ratio. So once we are able to figure out the insulin carbohydrate ratio for the child gets a flexibility. So present day diabetes management does not involve too much of food restrictions, though the focus on healthy food is always there, especially for a child who is growing. What we focus on is carbohydrate counting and matching the insulin to the carbohydrates. People are under misconception that fruits like banana should be avoided, and only Mari biscuit should be eaten, which is very commonly heard. But then, things like biscuits, any biscuits for that matter, would not be a very healthy food to eat if one realizes things like Mari biscuits are made out of maida, which is not a well, and sugar. And any day fruits like bananas would be a healthier choice. So we teach carbohydrate counting to our families so that it offers flexibility to the child. Is there any special diet for children with diabetes? What would be the best kind of diet for a child with diabetes? A child with diabetes needs to eat healthy like any other child. It's recommended to eat a good portion of fruits, vegetables, and pulses, grains. As far as the macronutrient group goes, we have three groups of macronutrients, that is proteins, fats, and carbohydrates, and each one of them supplies energy, which is measured in kilocalories. Proteins, 1 gram of protein gives about 4 kilocalories, and 1 gram of carbohydrate gives 4 kilocalories. 1 gram of fat gives 9 kilocalories. But that doesn't mean that they have a similar impact on blood glucose. It's the carbohydrates that is converted to glucose and absorbed, and which impacts the blood sugar. Carbohydrates is the most important source of energy for our body. The cells of our body are functioning 24/7, and it's glucose that comes from carbohydrates that supplies energy for these cells to function. Insulin is the key that unlocks the doors of the cells and allows glucose to enter the cells where it's burnt as energy. So glucose supplies about 50 to 55% of the energy for our body to function normally. The contribution of carbohydrates to the total daily calories would be about 50%. The proteins contribute about 15 to 20% of the calories, and fats about 30 to 35% of the total daily calories. So this should be the distribution of proteins, fats, and carbohydrates on an average. We don't micromanage on a day-to-day basis, but a healthy eating pattern with all the food groups involved supplies this amount of this proportion of the macronutrients. Now each meal, it's suggested that the carbohydrates be split among different food groups. There are 5 food groups which supply carbohydrates. One of them is the cereals, our rice, wheat, chapatis. And the other food group is the pulses, rajma, chana, chole, and other legumes. The third food group that supplies carbohydrates is the milk and curd dairy group. And the fourth is the fruits. And of course, the fifth, which is the least that we would encourage a child to consume, would be the junk food, the sweets and savories. Having said that, they do have the flexibility to include it in their diet with the carbohydrate counting techniques. It is easier for them to include it in an occasional party or a weekend outing. Would you recommend a low carbohydrate diet for a child with type 1 diabetes in order to manage the diabetes better? Certainly not. Low carbohydrate diets have been shown to increase the risk of growth retardation and future cardiovascular disease. Academies like American Academy of Pediatrics do not recommend this, and there are no guidelines to endorse this. Low carbohydrate diets can lead to growth retardation in these children. It can also increase the risk of cardiovascular diseases because low carbohydrate diets have been associated with increased blood lipid levels. When a child consumes low carbohydrates, there is a really high risk of developing vitamin and mineral deficiencies because most of the essential vitamins come from the carbs in the food. There is also a risk of the child developing some eating disorder because the diet ends up to be too restrictive. And there is lack of guidelines about this in childhood. So it's not recommended that a child goes on a low carbohydrate diet. I'm available for consultation at Aster Hospitals, Bengaluru, as well as for video consultation on Aster Health app.